What is the ASA classification system for plastic surgery anesthesia? Imagine preparing for a surgery and wondering how your health might influence the anesthesia process. The ASA classification system is a tool that helps doctors answer that question. It was created by the American Society of Anesthesiologists to assess a patient's overall health before surgery, including plastic procedures. This system helps the medical team understand the risks involved and plan the safest anesthesia approach for each individual. The system groups patients into 6 main categories, called classes, based on their health status. The first is ASA I, which includes healthy people with no medical issues. These patients are generally at the lowest risk during anesthesia. Next is ASA Roman II, for those with mild health problems like well-controlled high blood pressure or mild asthma that don't interfere with daily life. ASA Triple covers patients with more serious health issues such as poorly controlled diabetes or stable angina, which can limit activity but are not life-threatening at the moment. Moving up, ASA Roman IV describes patients with severe health conditions that pose a constant threat to life, like advanced heart failure or serious lung disease. ASA V is reserved for patients who are critically ill and unlikely to survive without surgery, often in a very urgent or emergency setting. The last category is ASA VI, which is for brain-dead patients whose organs are being donated. Sometimes the letter E is added to any class to indicate that the surgery is an emergency. For example, an ASA EE patient is someone with significant health issues needing urgent surgery. In plastic surgery, the ASA classification is especially important because many procedures are elective, meaning patients choose to have them. Knowing a patient's ASA class helps anesthesiologists decide how to manage anesthesia safely. For instance, a young, healthy person seeking a cosmetic procedure would usually be ASA I, while an older person with multiple health problems might be ASA Triple or higher. This classification guides the team in monitoring for complications, adjusting anesthesia doses, and discussing risks with the patient beforehand. It's worth noting that the ASA system isn't perfect. It doesn't consider all factors like age, the complexity of the surgery, or physical fitness. 2 patients with the same ASA class might react differently to anesthesia because of other health aspects. Also, the classification depends on the clinical judgment of the healthcare provider, so different doctors might assign slightly different classes to the same patient. Despite these limitations, the ASA classification remains a key part of preoperative assessment. Research shows that higher ASA scores are linked to increased chances of complications, longer recovery times, and more follow-up care. For plastic surgery patients, this means that those with higher ASA classes might need more thorough evaluations before surgery, closer monitoring during the procedure, and detailed discussions about the potential risks and benefits. From a safety and ethical perspective, using the ASA system helps ensure that anesthesia care is tailored to each person's health. It supports the principle of beneficence, which means doing what's best for the patient. It also promotes transparency, so patients are fully informed about their risks before elective procedures. Remember, always consult with your healthcare provider about your specific health situation, as many factors beyond the ASA class influence anesthesia safety and surgical outcomes. In summary, the ASA classification system is a simple yet powerful tool that helps anesthesia teams evaluate and communicate a patient's health status before plastic surgery. While it's not the only factor in assessing risk, it provides a valuable framework for making safer decisions. Always discuss your individual health with your medical team to ensure the best possible care tailored to your needs.